Hello, everyone. Good morning, good afternoon, good evening, depending on where you're all joining us from today. We would like to welcome you to this webinar, Untangling TB Stigma. What is stigma? While we wait for others to join, for more people to join, I'm going to give a bit of some explanations of what's today going to be looking like. This event is organized by KNCV TB Plus organization and specifically by the Stigma Elimination Group. My name is Bianca Tasca. I'm a researcher here at KNCV, where I collaborate with the Stigma Elimination Group. For those not familiar with KNCV, we are an international non-profit organization working to fight TB and other related diseases worldwide. And our focus includes strengthening health systems, improving diagnosis and treatment, and eliminating stigma. So yeah, we are very happy to see that from the registration forms that we received, there was a very diverse audience today. So we saw from the forms that there are some TB survivors, some people that work as program coordinators, as researchers, and this is very nice because our idea today is to exactly hear all the different perspectives from different parts of the globe and also to discuss together how stigma manifests in different contexts and what is people's experiences or needs and opportunities around the globe in regards to stigma. So yeah, to make this session more engaging, we would love to know where you are joining us from. So if you can please share on our chat and let us know where you're hearing us today, from which country are you. This will make it be able to make it more engaging, the session today. Another quick message is that throughout the presentations, we're going to have some polls and some moments to interact. So if you please can have your smartphones ready, because we're probably going to have like some QR codes that you can use to engage in the polls and during the webinar. Also today, we're going to be exploring how stigma manifests and also sharing some strategies, some of which KNCV have developed to tackle stigma. And it's nice and even more special that we are having this webinar today because today is Human Rights Day. So it's a nice reminder of the importance of respecting all individuals, which is at the core of eliminating stigma to all diseases. So before we start, I just want to give some few logistic notes. Firstly, this webinar is being recorded. So if you would like to rewatch it or share with others, you'll be able to access to KNCV YouTube channel. We will also share the recording link and a summary document with the key takeaways of the session to your email. Also, as you can notice, like participants, when they join, the microphones and camera are off. So if you want to ask questions during the session, please do it through the Q&A area. We try to address all the questions during the presentations, and if not, we'll try to address them after the 3 presentations that we're going to have today. And we'll have then an opportunity to interact and speak out. Another few notes. So as I said, today we're going to have 3 presentations, and at the end of the presentations, we all have a chance to connect a bit. And after the webinar, we will also send a survey for participants to understand what's your takeout of the session. So your feedback will help us to identify if this was a nice session, if it attended to your needs and expectations. So once again, if you haven't done it already, please just let us know where you're joining us from. If you can put in the chat which country you're attending from. And I believe we can get started. So it's my pleasure to introduce our first speaker, Fiekert. Kathy is a public health and infectious disease specialist with over 30 years of experience. Here at KNCV, she leads the Health and Community System Solutions team and the stigma reduction initiative. So Kathy has involved in developing KNCV stigma reduction tools and also contributed to WHO and Stop TB guidelines. And she'll be setting the stage for today's discussion with her presentation, A Recipe for Stigma, setting the scene. So Kathy, over to you.
Thank you very much. Yeah, so please have your smartphones at the ready because you will need them. I just need to move my screen around. Thank you very much. So, stigma. First of all, I'm here to set the scene and I want to turn the world a bit upside down. So I'm starting with the acknowledgements, just why not? Because this whole work is based on many, many people who inspired, informed, and facilitate the body of work. And there's way too many to actually thank in person. So I've put a few pictures up there, but there's many, many more. Now, this is really from and for the people that are the real heroes, in my view. They were brave enough to share their stories with us and to contribute to tools and to the fight against stigma, I guess to make the world a better place for the people who follow in their footsteps. And then, of course, there is the ones who are willing to listen with open hearts and minds, and that stood and still stand with them. And I really hope that after today's session, you will become one of them if you are not already. So, what is stigma? Now, I would really like you to scan this code if you can. If not, there is a little, it will come up on the screen. Yes, it does. If not, you can basically join this at menti.com and you use the code that's up on the screen. Let me know what your ideas about stigma are. It's easiest if you sort of use single words. Maximum 2, otherwise it becomes a bit confusing and confuddled. But yeah, over to you. What is stigma? If something's coming up. Okay. Yes, othering. Evaluation, denial, social processes, prejudice, shame, discrimination, isolation. I can see that some are coming up more often. They become the ones that are bigger. Keep them coming. You've got 23 responses so far. Any other takers? 24. Okay. Yeah, well, keep them coming. We are coming back to this in a little while. So, stigma, as so many of you have identified, it's pretty much a labeling of people. It's officially defined as a relationship between an attribute or stereotype that's assigning undesirable labels and qualities and behaviors to a person. And once we've labeled them appropriately or inappropriately, we then use that to devalue people socially, and that leads to inequalities and discrimination. But how do we make stigma? How does stigma get created? Now, a good friend and ex-colleague of mine, Ellen Mitchell, has many, many years ago created a recipe for stigma. If you want to cook up stigma at home or in your community, well, how do you do it? So you first need to find a difference, and you need to label that difference. You give it a name. So people with red hair, someone who is diabetic, someone who uses a wheelchair, someone who is coughing, someone who is a smoker. You know, there's many, many different labels that you can apply. Some of them are labels. They're just describing things the way they are. But some of them become weighted. They become more pertinent. So, you know, you would probably not worry too much about the color of someone's car, but, you know, someone's food preferences, well, we could be a little bit snooty about that. So we give them a name and we define a difference. We then link them to a negative trait. So we suddenly say, oh, that difference, you know, anybody with red hair is a hothead. You know, that is basically giving a negative trait to something. Someone who has diabetes, oh, they don't monitor their diet. I mean, you've never seen a dentist being, you know, uncontrolled diabetic. You say someone with blue eyes, you know, oh, they can't be trusted. You're putting something negative to what was just a difference. You then establish that it is the responsibility of the person and that there is a blame to be had. It's a bit harder with red hair and blue eyes, but you can certainly say, well, you know, you're diabetic because you've been overweight, or you have a problem with your liver because you've been drinking. Well, you are having a respiratory problem because you have been a smoker. So you basically put the blame on the person. Then you will separate us from them. We are not like them. We are not smoking. We're having a good diet. We're doing exercises. We are not like them. Tick. Then all you need to do is basically put a bit of a peril to the situation. And nowadays we all seem to be doom scrolling and really looking for the negative in everything. So suddenly that person with that difference and that blame for the difference is now dangerous to us. So someone who has red hairs, has red hair, they might not have caused it to themselves, but, you know, the family really shouldn't have sort of, you know, carried on having red-haired children. I mean, you never know. Should they be allowed to drive a car if they are so erratic? Well, should someone who has diabetes drive a bus? Because what happens if they get, you know, hypoglycemic shock? They are a danger to us. And we've all very much firsthand experienced that in COVID. Who of us hasn't been in the supermarket and had to sort of suppress a coughing fit because everybody's eyes turned to you? Well, and once you've justified that a person is a danger to you, then it is quite easy to actually curtail their rights. You can basically say they shouldn't really be allowed out in public. They shouldn't really be amongst us. They shouldn't share our food. They shouldn't share our time. They should be somewhere else. Tick. It is that easy to create stigma. Now, we rarely make a conscious decision to stigmatize people. I mean, unless you're in high school and you've got it really in for the kid in your class, you wouldn't necessarily go about and say all the redheads are weird, all the tall people are, you know, this, or the short people are that. That's a thing that we all practice very well in school because we other, because we see how people get othered by the example that our parents, our community sets us. So we generally do not wake up in the morning and think, how can I single someone out with blue eyes? What drives stigma? And I see some of you have already started. Very good. Please put your idea of stigma drivers onto the screen. Why are we stigmatizing? Okay, lack of awareness, misconceptions, and unconscious bias. I will come back to that later. Lack of awareness, fear. Fear is a big one. Intolerance, very good. Lack of knowledge, yes. Groups, interesting. Looking for a Sonderbock. I need a Dutch person to translate that for me. Feeling superior, okay. Keep them coming, keep them coming. Very good. So we've got these drivers. Now, some of them were fear, ignorance, prejudice, guilt and blame, and so many more that I haven't even thought of. So I will have to adjust this graph in the future. This is a slightly tricky one. I want you to think about just these four, but you can do that really in future with all of the other ones that you've listed. Can you rank them on the app? You should be able to have a little slider from 0 to 10. Can you tell me that driver, what effort would it take to address that? And what impact would that driver have on the life of the individual that basically this is aimed at? So it's a slightly harder one. Anyone yet? Yes, okay. Prejudice, right. Big impact on people, hard to change. I've got questions about that from you later on. That's very good. Ignorance is not so hard to address. Fear, moving up. Guilt, blame. Interesting. It's moving. Interesting that all of these have a really large impact on the individual. I wish I had put some more of the other ones on that you've come up with, because it would be a very interesting picture. But maybe we can do that again in another round, or even after the session. Right, keep them moving. And think about them later on. Now, stigma can be easily resolved through. There is no wrong or right answer here. Try to rank how easily stigma could be resolved through any of these. Okay, right. We got laws, education, 4, experience, right, very good, empathy. I'm curious to know what the other is. So please, 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 could you put, whoever puts up other, could you please put some comments into the chat for us, just so that people can pick up on that. Brilliant. So the majority is experience, empathy, education. Laws are creeping up. Okay, very good. Keep it going. And as I say, please put comments into the chat, because that's a really important discussion to carry on. Now, while we're doing this, I want you to do a little exercise for me. And again, I mean, there is no right or wrong. There is no prizes to be had. But on the count of 3, I want you all to hold your breath as long as you can. And then put up your hand when you start breathing again. Now I need Bianca there to help me when we have the quorum that the majority of people put their hands up, because I can't see both screens at the minute. So on the count of 3, hold your breath as long as you can. 1, 2, 3. We still haven't got a quorum yet. I basically ran out of air a while ago. Okay, are there still some people going? Do we need to send first aid round?
Yeah, I think we have almost half of the...
Okay, all right. The ones of you who still haven't breathed, maybe now is the time to actually catch some breath, because we don't want any casualties on here. We want you fit for the rest of the session. So what if you could catch a disease just because you couldn't stop your body from breathing? Because no surprise there, it's involuntary. We can't actually physically stop ourselves breathing. Our body will basically knock us out and then start breathing to stop that silliness. So what if you could catch a disease just because you couldn't stop breathing? Oh, wait, does that sound familiar? TB, COVID. Was it your fault? And with that, I will hand over to the next speaker. Thank you.
Thanks, Kathy. Thanks a lot for setting the ground of today's discussion and showing us like this, unfortunate recipe to stigma. And I would like to invite Niesje, our next speaker. So Niesje is a senior consultant with 35 years of experience in TB nursing and 20 years in education. And here at KNCV, she leads the Dutch team, developing training for healthcare workers and focusing on stigma reduction in TB care. Niesje has worked on stigma reduction projects in Malawi, Kazakhstan, the UK, and the Netherlands. And the floor is yours. Let me put the presentation up. Yeah, I think you guys can see it now. Go for it, Niesje.
Okay, thank you, Bianca, for the introduction. Now we have heard from Kathy what stigma is and experienced a little bit what stigma is. My presentation is more focused on how stigma and the fear of being stigmatized is influencing people, as well people who are diagnosed with TB as healthcare workers, but also how it affected communities. Stigma is affecting the whole patient pathway. There are a lot of possible health impacts of TB stigma. And to start with the care-seeking behavior. And people are delaying seeking care, so diagnosis is delayed because of the fear of being stigmatized, of being recognized as a TB patient. It will affect as well the individual patient as the communities, as when people are infectious, they will become longer in the community without being diagnosed and treated. So it will affect everyone around the person with TB. Stigma is also affecting treatment initiation and completion. When people are hiding their diagnosis due to stigma of the fear of being stigmatized by friends and family, it has a strong influence on treatment adherence because they have lack of social support. It's more hard to, why are you taking medication? Why are you so tired all the time? Why are you not drinking alcohol together at a party? When you haven't told anyone about your TB, there is less social support, so it's very hard for treatment adherence. And it also has its effects on contact investigation, of course. When people have due to a fear, lack of participation in contact investigation, they won't give you the names of people they have met in the past, of people of about their friends and family. It affects as well the patient with TB as also the community who is not proper investigated for TB infection or TB. Why is addressing TB stigma important? It's important because it has a huge impact on people's life. As Kathy has said, stigma separates us from them. And there is a lot of social and economic aspects of stigmatizing people. And today is the day of human rights, and stigmatizing has loss of rights and the respect of others, because people lose their status in the community. And also discrimination by healthcare workers, by providers of care, is one of the fears and one of the impacts when people are stigmatized. It also has some degradation of social capital, the fear of divorce, drop out of school, less contact with friends and family. During the union conference, I spoke to a young lady who was diagnosed with TB, and people around, healthcare workers said to her, "Don't tell anyone you have TB, because you never get married again in your life," when they knew you had TB. And also loss of work, the fear of losing one's job when telling people about TB can have a great impact on catastrophic costs due to tuberculosis. So stigmatizing and stigma also contributes to the catastrophic costs we have on TB in the world. But stigma is not only affecting people who have complaints or are diagnosed with TB. Stigma also affects healthcare workers working in TB prevention and care. A story. Anna went to the doctor for a chest X-ray, and she was informed that she does not have TB. After her shift, she meets with some colleagues who are not from the outpatient department to tell them the good news. She hopes that it will put them at ease, as she has noticed that they behave differently towards her since she started working with TB patients. When she coughs, they always get very nervous and move away from her. They often inquire whether she really likes her job and whether she would prefer to do something else. Anna sometimes wonders if her colleagues think less of her because she works with TB patients. Is this familiar for you? Do you recognize this story? Working in TB prevention and care is in many countries seen as dirty work. Being stigmatized and excluded as healthcare workers can not only affect yourself and your mental health, your well-being, but it can also affect the way you treated patients. And one of the roles nurses have, I'm a nurse, is to provide a caring environment. And this comes into danger when people are stigmatized due to what they are doing due to their daily job. And this is not only for TB. We also see it during the pandemic that also healthcare workers treating COVID patients were seen as heroes, but were also stigmatized. And one of the articles you see on the screen is from Ineke, Spruijt and others. And we interviewed 53 healthcare workers in 5 countries in that study. And they tell us about the effects of being stigmatized. KNCV has developed several tools which we use for stigma reduction intervention. And some tools are more focused on TB patients, like TB Photo Voices and From the Inside Out. And the Allies approach is a tool focused on healthcare workers. Kathy used also some exercises, an exercise of one of these tools. We enrolled the interventions from these tools in several countries. And I also enrolled some interventions, and it's always very informative and interactive interventions, but also a lot of fun because we have very interactive exercises which have great impacts. In Malawi, we also enrolled the Allies approach, and we started the training of trainer sessions there in April 2022, and in the end of 2022, we started with 17 healthcare workers. They were part of the trainer sessions, and in the end of 2022, 373 healthcare workers were trained by the first participants in Malawi about the Allies approach. And that it has its impact, I showed you by one of the quotes of one of the participants of these trainings. And she said that these exercises are wonderful. It makes you feel guilty at one point. Then a feeling of happiness and proudness for helping others, but mostly regretting on how I have treated others. It makes me cry. We rolled out the interventions in several countries, and I give some examples. In Kazakhstan, we did an assessment and a photo voices project. On the right upper corner, you see some pictures of the photo voices project, which were in a corridor in a hospital in Astana. And a few years later, we introduced also the Allies approach training of trainers in Kazakhstan. And currently, this is rolled out, and now the Allies approach is integrated into primary medical education in Kazakhstan. In several countries, we enrolled also Photo Voices project, and as a result of this project, mostly a public information campaign or an exhibition was part of this project in Nigeria, in the Philippines, in the Dominican Republic, and on the left down corner, you see on the right corner, you see the exhibition in one of the university hospitals in the Netherlands, in Nijmegen. And this was an exhibition as a result of the Photo Voices project around World TB Day in 2024. Oh, sorry. I like to end with one of the pictures of one of the participants from a Photo Voices project. It's always very impressive to do these projects with TB survivors and with healthcare workers. And I like to thank all the participants in the sessions for sharing their stories and pictures, and all past and present colleagues of KNCV. Thank you for your attention. And I hand over to Bianca.
Thanks, Niesje. Many thanks for this presentation that we can see the effects of stigma on people's lives, and also super nice to see all the work you've done. Now I would like to invite Ineke Spruijt to give her presentation. So Ineke has a PhD in epidemiology and has now over 8 years of experience in TB research and guideline development, implementation and evaluation. Ineke is specialized in TB and migrants and implementation studies, and she leads research projects, particularly around implementation of new interventions using mixed methods research approaches. And she's also involved in the development of and implementation and evaluation of guidelines on TB and care and prevention. Ineke, over to you.
Thank you. Thank you all for joining this webinar. We've had 2 very interesting presentations from Kathy and Niesje. So I'll do my best to make it as interesting. Today I will talk about the introduction of the health-related stigma and discrimination framework. We talked about what stigma is, how it is, what it constitutes, how we can experience it, and I will introduce a framework that I personally very much like, that is very handy in assessing stigma, but also in evaluating interventions. So there's various definitions of stigma, and one by Scambler et al. Scambler described stigma as a social process either experienced or anticipated that is characterized by exclusion, rejection, blame, or devaluation that results from experience, perception, or reasonable anticipation of an adverse social judgment about a person or a group. Stigma is a universal concept in a way that societal norms and values define what acceptable attributes and behaviors are for the society, the members of that society. And the society's mechanisms of social control actually ensure that members conform to those society norms. In that sense, society members generally share a broad view about what constitutes stigma. They share common beliefs about both the cultural meaning of an attribute and the stigma attached to that attribute. Whereas stigma is a universal concept, what constitutes stigma differs between societies because societies have different cultural norms, values, structures, and different cultural beliefs. And these beliefs dictate the nature of a stigma, the specific attitudes people hold about a given stigma, the responses of stigmatized persons, and the way in which a stigmatized person is integrated in a social group or not. So if we really want to understand stigma, we need to understand the broader social, cultural, political, and economic forces that structure stigma. And we should not distinguish between the stigmatized and the stigmatizer, or else us and them, what we've heard before. The health, stigma, and discrimination framework is a framework that can aid in doing that. It talks about drivers and facilitators of stigma. It talks about intersecting stigmas. It talks about how stigma manifests, but also about the outcomes without distinguishing between the stigmatized and the stigmatizer. Current studies that we see in literature are often focused on the manifestations of studies. They focus on the individual being stigmatized or the individual that is stigmatizing. And they describe the manifestations of stigma, such as the stigma experiences and the stigma practices. To a lesser extent, they also distinct between the different types of stigma and stigma practices. And to even a lesser extent, they talk about the social-historical context of that stigma and the cultural milieu. But these are very important if we really want to understand how the stigma, what constitutes the stigma. We need to take these things into account. Assessing only the manifestations of stigma does not provide answers to the questions on why do we behave the way that we do? Why do we think this way? Why do we isolate a person? Why does a person with TB isolate themselves? Why does the community exclude a person with TB? Why does a person with TB keep their disease to themselves, etc.? Many other why questions. One aspect that could answer the why questions is to look at the drivers and the facilitators of stigma. The drivers of stigma are inherently negative. For example, it could be fear of infection. It could be a social judgment and a blame. It could be fear of social and economic ramifications. Facilitators, on the other hand, could be positive or negative influences, such as the protective supplies that healthcare workers wear in healthcare facilities. And the drivers and the facilitators combined determine whether and how stigma is applied to people or groups. From the drivers and the facilitators, we move up to this intersecting stigmas. And this is also a very important one to really untangle stigma, because health-related stigma often co-occurs with other intersecting stigmas. For example, with TB is stigmatized because it links to other disvalued characteristics in some contexts. For example, it links to HIV, which is a stigmatized in itself, or malnutrition, or it is linked to poverty or low social class, or being a migrant. If we move further up, and we've already talked about the manifestations of stigma, we can also talk about the outcomes of stigma. This is also important to assess, because the manifestations of stigma may actually influence the right to health, the access to health, acceptability of health, uptake of testing, adherence to treatment, but also resilience, the power to actually challenge the stigma. So the framework, as we have seen, helps us to untangle stigma, to understand and assess the various aspects that constitute stigma. But it also helps us to monitor TB-related stigma, as it identifies these various key areas. Monitoring TB-related stigma at the program level is important to inform appropriate interventions. And for this, we can use information on stigma drivers and facilitators. At the program level, it's also important to assess the impact of interventions to reduce stigma and to identify the need for training or changes in policies to ensure a stigma-free healthcare environment, for example, and to raise awareness to facilitate change. For these objectives, we could use data on stigma manifestations. At the national level, we would like to monitor TB-related stigma to inform funding and scale of programming to address TB stigma and to identify gaps of new interventions or programs. And for these objectives, we could use the data on the outcomes of the stigma. My take-home message for today is that stigma is a highly complex social process. It does not only consist of manifestations. We need to understand the drivers, the facilitators, the intersecting stigma, and the outcome. We need to consider the broader social, cultural, political, and economic forces that altogether structure the stigma. And we should not distinguish between the stigmatized and the stigmatizer. The health-related stigma and discrimination framework is one framework that can help you in doing this. If you're interested, I have a take-home exercise and where you can, for your own setting, you can fill in the drivers, facilitators, intersecting stigmas, and the other key areas. And by filling this in based on evidence published in literature, you can see where the gaps are in your knowledge on how stigma is constituted in your setting. Thank you very much. Give the floor back to Bianca.
Many thanks, Ineke, for wrapping up this talk. I will quickly hand over to Kathy so we have enough time to have a bit of discussion today. So Kathy, if you want to go for the floor, and thank you everyone, and yes, hope to see you following.
Thank you very much. Yeah, I mean, please keep the discussion going. Write something in the chat. The group is a bit too big to have sort of an open mic session. So please try and write your comments in the chat. If you've got questions and answers, put them in the questions and answers. I hope you still got your phones open, and anyone who's got a better eyesight than mine can do this on a phone. If not, don't worry too much. I will send all of these exercises around later so that we can keep talking about this. Place yourself on the map if you can. It would be lovely to sort of see where everybody is spread out. We've got some people from very far away. That must be very late already, your end. We've got someone from Latin America that is either very late or very early in the morning. I'm now super impressed. Yeah, stick yourself on there. Keep the questions coming, keep the comments coming. I will move to the next slide in 15 seconds or so, because we have a few more questions that we really would like to have your opinion on. A lot of people from Europe. Yeah, I hope you can still carry on doing that, even if I shift the slide. I haven't actually worked this out yet. So, what do you think are the priorities to address in your particular area of influence? That means where you live, where you are, where you work, and the things that you really can shift. Giving everybody $1 million, probably not happening, not your call to make, but if you can shift something in your area, what would be the priorities to address when you want to eliminate stigma where you are? And this one is one where you could write a little bit more if you want, but shorter answers are easier. You can also look at what other people have said and agree with that. Then it sort of becomes more weighted. I'll give you a minute or so, or a couple of minutes to think about this. We have basic education, health education, awareness raising. Awareness for stigma should be improved by information and education. Systemic unconscious bias, racist discriminatory systems. Yes. Community mobilization. Sharing stories to increase empathy. I really like that. And that's something that Niesje has told us quite a bit about it. At that point, it's also time for me to sort of put some credits in there. All the pictures that I've used today have actually come from the photo voices and created by participants. Let me click to group some responses if we can. Just to sort of see, and you will get all the results as well. We're going to share everything with everyone who participated today. Okay, so far we've got community engagement, 6 responses, awareness, 6 responses, new responses uncategorized. Okay, communication, basic information about TB. Okay, let's see what else we have, if I can see them here. Oh yeah, mass media campaign, sharing stories, education, awareness, training of healthcare workers. Excellent. Again, 19 responses out of 65. I hope that isn't because people can't see the slides or can't get into it. Please keep those responses going, because as I said at the beginning, this whole work really circles around the experience that people have. And so far, all attempts of having generic responses to stigma have really failed, because it is very culture and environment dependent. And that's something that we've learned, that wherever we go, we have to actually tweak our response. We have to tweak the activities that we do to make them really fit the situation. Otherwise, people will say, stigma, stigma, we don't have stigma. Doesn't happen here. Right, on to the next. This is something for you, please, to prioritize. What are the priority needs? Do we need to work on policies, research, training, toolkits, strategies and plans, or other? And I still haven't seen any answers of the other from the previous questions. You can rank them, so you can shift them up and down, what you think is the most important of these, and put them in order of have to work through. Again, I'll give you a minute or two to think about that. What are the priority needs in your area? Okay, training and toolkits. Clear winners here. Strategies and plans, policies, research. Okay. Yeah. Dying to know what the others are. Please put that into the comments. Okay. Yeah, still moving. Yeah, training hasn't been shifted from the first spot. So training, strategies, plans, toolkits, then policies, and then research. Nope, toolkits have just moved up. Very good. Any other takers? Last call. All right. Thank you. There's still time to carry on. I'll move to the next though, because I see we are running out of time. The focus areas. Now, how would you rank those? Do we need to concentrate on individuals, the affected populations, communities, healthcare workers, health facilities, national policies? How would you rank those priorities? Now, you are informing what priority areas should be looked at. So this is a really important input. What should we focus on?
Kathy, just a comment like from the previous question on what are the other strategies that we can focus to stigma. We have on the comments some comments.
Okay.
So your role plays, advocacy, influencers can play an important role, and also language matters, translation and words used.
Excellent.
And
words used is really important. Yeah.
As a way of impacting,
Okay. All right. Interesting. So most people say healthcare providers and communities and the affected population sort of equal, and then health facilities, and then individuals and national policies. Really interesting. Thank you very much. That is really helpful. And again, I mean, if there's any others here, please stick them into the chat so that we can record that as well. A lot of work has been done so far towards healthcare providers. It would be really interesting to hear from you and your experiences, how to deal with affected populations and communities. Affected populations is particularly when we talk about how can we provide some support to build resilience amongst newly diagnosed patients or their families on how best to support them, because a lot of people, as you've pointed out quite rightly in the beginning, deal with fear and fear of discrimination and all the consequences. I'll move on. I'm conscious of the time. If you have limited stigma resources, stigma reduction resources, how would you split it? Say you've got 100% of whatever your budget is. If you had to have to divide that up between these categories on the board, research, policy development, training, toolkit development, interventions, or others, how would you divide it up? And I know it's a bit of an academic question because we don't know how much money there is, but we all know that resources are finite. So, yeah, okay. Toolkit development and training, they go sort of up and down together. That is where a lot goes. And the intervention, so that's an even keel. less so for research and policy development. All right. Okay, training up, toolkit development, interventions. Another 30 seconds. Any last takers? Okay. Oh, still moving. Oh, I now wish that we had some more time. This is really, really interesting. Thank you. But I don't want to miss out on the last one, so I'm moving you on. Because the last one is almost the most important. If you could give us any recommendations or any requests to us on what you would want, is there any training? Is there any tool? Is there any question? Is there any initiative or anything that we could do better? Let us know now. And I know this is really whizzed through, so we will send a version of this to you with all the slides where you can basically do it at your own time with a bit of thought. You could do it with your colleagues and send us back the results and let us hear how this is going for you. Okay, training on intersecting stigmas, training of healthcare workers, focus groups, champions, yes. Community engagement, involvement. Oh, anthropologists, that's a good one. I will need my colleagues to translate the Dutch. Let's challenge social norms. Like that, I always like a challenge, and I like to challenge norms. Could share the recipe of stigma, absolutely. You will get all the slides and all the presentations. So keep writing on this one. It should hopefully carry on while I move you to the last slide, because we are at the end. But we want to hear from you. And if you want to get in touch with us, there is some addresses on here. Thank you so much for making the time to come and join us.